TV show, I think Dr. House, and he mentioned that it's called the liver because you cannot live without it. That's that's so many
interesting,
things.
yeah.
Yes. So that's why it's called the liver. It has so many vital things for the human body. Detoxification, it helps with absorption. So it produces a substance we call bile salts.
Bile salts.
Yes.
Okay.
That aids in absorption and also breakdown of food. And then the common medications that we take, most of the medications, from paracetamols to even the herbal medications that we take, it's the after the medication has worked, and sometimes even before it works, it's the liver that breaks it down to make it harmless, so that it can be taken out of the body. So in as much as it helps with digestion, it helps with absorption of the food that we eat to get the ingredients, it also helps break down medications.
Okay.
It also produces what we call clotting factors. So when we have an injury, when we are bleeding, the liver produces substances that helps the blood to clot. That's in simple terms, it helps us to stop bleeding. So the liver also does that. And also another vital function is it produces proteins.
Okay.
So we all know about proteins. I think most typically albumin.
Okay.
The liver produces albumin. It helps us carry substances in our blood. It helps with healing. It helps with building new substances in our body. And also the liver is also responsible for fighting infections by producing what we call immunoglobulins. Immunoglobulins are some kinds of proteins. So when someone has an infection, a bug, even malaria or any viral infection, the liver helps produce these immunoglobulins that will help fight these infections. So from all that I'm saying, you realize that the functions of the liver
are many,
and they are vital to the function of the human being.
So then the liver is it's quite, it's very important to the human being. Like it's very important to our function. Like you said, you can't live without your liver.
Without it, yes.
And it's quite, for those of us who know, it's quite a big organ,
yes.
In the body. At what point in time, like what can affect such a very powerful sort of engine for the body? Because it seems to do a little bit of everything. For the human being, and everything, we know everything we do, we take, goes through the liver.
Yes.
So what would put somebody at risk of a liver disease? Like we can look at all the other types before we come to the one that people think commonly, which is the viral hepatitis. But what are some things that can put your liver at risk of disease?
Okay, so since our discussion today is centered on hepatitis, I think I will focus in on that. So due to the many functions of the liver, there are variable number of things that can affect the liver. Like any machine or any engine, I should say, when you overwork it, you cause it to break down.
True.
In the same way, the liver, when you overwork it, then you can cause it to become inflamed. Most notably, some of the medications that we take, even paracetamol. So when you go to the hospital, you are given a dosage that you are supposed to take. When you take beyond that dosage, and you take more often than you are advised to, you give the liver more work to do.
Even common paracetamol?
Even common paracetamol.
Wow.
You give the liver more work to do. So you realize that then it has to rule in all its reserves and resources, and you cause it to become inflamed. And other medications, notably herbal medications as well. All medications that are given have to be regulated. In terms of dosages, the amounts that the liver can deal with. So there are some herbal medications that are not really studied very much and not regulated. So when they are taken in harmful quantities, they affect the liver. They can cause a liver injury. They can cause hepatitis. You've already mentioned the viruses. There are numerous viruses that can affect the liver. But notably, we have the viral hepatitis from the, we call it hepatnavirus. So the hepatitis A, B, C, D, E. These are viruses that can also harm the liver. So they infect the liver. And there are other viruses also, CMV, EBV, I will not bore you with it, that can also affect the liver as well. Interestingly, the body can also fight against the liver.
The body
the body itself, the body cells, yes. So the immune system is supposed to fight against foreign substances and infections, but sometimes they can mistakenly fight against the liver.
It's like your own body will fight against your own liver.
Yes.
Okay.
It's an autoimmune disease. So when it happens like that, we call it autoimmune hepatitis.
Hey, autoimmune, that's my pain. Sorry. Okay.
Yes.
So the body can fight against itself. You can harm your liver from external sources, herbal medications, including even the well-regulated ones like even common paracetamol.
Yes.
So it means that when you're taking care of your liver, when you are even concerned about your liver, you should be careful what you're taking in, like what you're taking into your body, right?
Yes.
Okay.
When it comes to the liver, prevention is the mainstay of liver health. So prevention. I think we cannot even say it enough. Is the mainstay of liver health, and that is why we advise people that when you are ill, when you are not well, you see by a licensed physician, a licensed doctor, so that you are well taken care of. Because there are so many things that can harm you.
That we cannot overemphasize.
Yes.
That, I mean, if you are unwell, visit a licensed, qualified practitioner, and then make sure that you are getting the best for your money.
Exactly.
Make sure you are getting the best for your money. So, I mean, those are the, like I say, risk factors when it comes to hepatitis. But what will let you even see or know that there's something wrong with my liver? Are there telltale signs? Are there things that will show that your liver is compromised? Will you see it?
Yes, there are signs of liver disease. Mostly they are grouped into, so broadly, we have acute signs and we have chronic signs. Okay, so acute means it happens, should I say acutely, it's a short term.
A short period of time.
And then the chronic is long term. Okay, so things that affect the liver acutely, it affects it in stages. Okay, so when the liver is affected, we call something the prodromal stage, where it releases substances, that cause us to have fever. Okay, so when the liver is affected, the person feels warm or their temperature becomes hot. Okay, they feel generally ill, they feel unwell, they may vomit, some may have diarrhea, joint pains. So non-specific symptoms, like they are like malaria-like symptoms. So most of the people who say I have malaria, some people can come to the hospital and we ask them what is wrong. They say, "Oh, doctor, I have malaria."
I have malaria.
Yes, and you have to actually now go into detail and find out exactly what it is. So it can present just like malaria.
Wow.
Yes.
It can present just like
malaria.
How malaria presents.
Yes.
And it may be liver disease.
Interesting. Yes.
Interesting.
And when it goes on to the next stage, where the function is affected.
The function of the liver is
affected. Then you realize that all these harmful substances that the liver was supposed to take out of your body, they begin to accumulate. So we've heard of jaundice before. That is the yellowish discoloration of the eyes. Okay, these are caused by bile salts. They were supposed to be eliminated, but due to build-up, they become deposited in your eyes, and your eyes become yellow. If you have fair skin, you may see yellowish discoloration of the skin as well. But that skin is difficult to see. So we use the eyes. So they become jaundiced. Now, if it becomes prolonged, remember I mentioned that the liver is responsible for blood clotting. When someone bleeds, the liver produces substances that are supposed to help stop the bleed. So when the liver is affected and it's not producing these substances it's supposed to produce, then the person bleeds longer. So they bleed longer than they should. There are tests that we do to verify that as well. There may be malabsorption. Yes.
Okay.
So you realize that, excuse me to say, in the hospital we call it stools. Okay, so fecal matter. So your stools change in color. The liver is responsible for producing that substance that gives the stool its brown color.
It's brown color. Yeah.
So when the liver is affected, you lose that brownish coloration of the stool. It becomes pale. becomes pale. So the stool's color changes. So when you see someone, you realize that the color of their eyes have become yellowish. Sometimes it's very subtle. And the stools are changing color. And most notably, remember I said that the liver is in the upper part of your abdomen to the right, around where your right elbow rests. You feel pain there.
You feel pain?
Pain, yes. The place becomes painful. So if there's anyone that has pain in the upper parts of their abdomen, and the layman, they call it stomach. Okay, they are the right side. And then the person's eyes have changed color, has become yellowish. The stools have changed color. This person most likely has an established liver disease or established hepatitis.
And don't people would usually assume pain on this, on this part of their in their stomach, anywhere around their stomach, to say, oh, I have ulcer, oh, may were ulcer. But like you're saying, it may not be an ulcer. It may be probably the first sign that you have a liver disease. Because when you get the jaundice, when your eyes are yellow, usually when people tell you, you may probably then know that you have. But if nobody is telling you and you think that that's the color of your eyes, you will not know that you have liver disease. But we hear, most often in the media that, oh, this person had liver disease and he didn't know, and then maybe they are late or they've passed on. Is it that we have not given enough education about liver disease?
Yes, that also could be true. But nowadays things are changing with the media now being readily accessible to everyone. We are making noise about the liver disease, liver health. And this month we're actually doing it. This month is a liver health awareness month.
Okay.
And the 28th July is actually World Hepatitis Day.
28th of July.
28th of July is World Hepatitis Day. So we are making so much noise about hepatitis, liver disease, and there will be health screenings that are going to be undertaken. And I think the information will come out shortly as to where
you can go for.
And there are free health screenings as well to help you know whether you have liver disease. And I should mention, in as much as the liver disease will present with the pain, the jaundice and all, sometimes you may not see any signs.
It can be silent.
It can be subtle, yes.
Wow.
Yes. So then screening becomes the mainstay of identifying if a person has liver disease.
So sometimes you may even have the liver disease, but because you have not been screened about for liver disease, you will not know.
You will not know.
You
will not know.
Anyway.
And those are the dangerous ones.
True.
Yes.
True.
Those are the dangerous ones.
If you're just tuning in, this is 107.9 Orange FM, and this morning I'm with Dr. MALDWYN. His name is very nice. So MALDWYN ANSAH. MALDWYN ANSAH from the Internal Medicine Unit at Confanoch Teaching Hospital, and he's talking to us about hepatitis. And you can see we're not just saying hepatitis B, because that's what a lot of you know, but we're talking about hepatitis in general. We will narrow down to what people are commonly used to hearing, which is hepatitis B. But we're talking about hepatitis, and like as he says, 28th of this month is Hepatitis Awareness Day, and there will be avenues for people to check the health of their liver or the status of their liver. MALDWYN, let's try and clear up some doubts that people have about hepatitis. Sometimes people think hepatitis in general is caused by abuse of alcohol or alcohol intake. Is it entirely true? Is it true?
So there's a reason I reserved alcohol. Yes, so alcohol can cause hepatitis.
Okay, so alcohol can cause hepatitis,
yes,
but not hepatitis B.
No.
Okay.
Not every hepatitis is alcohol.
It's alcohol.
Yes.
Okay, interesting.
It causes stigma. It causes stigma because now, whenever someone has liver disease, lots of people assume it's alcohol.
It's alcohol that has led to that.
Yes. Now, there may be people taking alcohol in moderation, normal quantities or small quantities, and may have hepatitis B, or may have other things causing hepatitis. Not necessarily the alcohol. But like I said, because the liver functions, and when you give it too much to do, can cause inflammation. The same way, when you take too much alcohol at a time, or when you take it for prolonged periods, it can cause hepatitis. So alcohol too can cause hepatitis.
Okay.
Yes.
Okay. So alcohol can cause hepatitis. Can you inherit hepatitis? So, is it a hereditary or genetic disease?
No. So when we talk about hereditary, meaning the person's parents has it and then they pass it on. No. So technically, it doesn't happen like that. However, during the birthing period, if the mother has viral hepatitis, like hepatitis B, it can she can pass it on to the baby during the birthing period. So in that case, it doesn't really become hereditary, but it can be passed on from the mother to the child.
You know, before we came on air, producer was asking whether you can get hepatitis from somebody's sweat or just by hugging somebody, the person is sweating. Say, hey, Miss Rose, mania hepatitis. Is it true that you can get from sweat?
I remember when I was younger, way younger, and then a lot of noise was being made about hepatitis B. They used to say that, even when you go to church and they say, you will handkerchief, then they'll be waving a handkerchief, people will get hepatitis.
Hey.
So there are a lot of misconceptions. Yes, the viral hepatitis mainly exists in blood.
Okay.
Blood.
Okay.
There may be some in bodily fluids, like the saliva, other bodily fluids, but the quantity is very low to cause an infection.
Okay.
So unless you are exposed to bodily fluids prolonged period, you have a cut on your skin, I mean, it's too far-fetched, and the risk is very low.
Very low.
But normal sweating, hugging, pecks, like, or even a normal kiss, has little chance of transmitting hepatitis.
It's good for people to know because people usually get worried. One of the other things with hepatitis is people think once you are diagnosed with hepatitis, I was say and as I say, a dream say be obituary. Is hepatitis a death sentence?
No, not at all.
Okay.
Not at all.
Okay.
Actually, most people who get hepatitis recover.
Oh.
Yes.
Oh, sir.
Recover in the acute stage. Yes.
Okay.
Most people recover. There are only a few, should I say, immunocompromised. But when your immune system is not functioning very well, then you have the propensity to develop a chronic disease that becomes long-term.
Long-term.
Pregnancy too, it can also harm the pregnant woman. But most people recover from acute hepatitis with treatment. They recover from acute hepatitis.
I mean, we'll come to treatment in a bit, but one of the other things is, there was a time, I can't seem to remember, probably about 4 years ago or thereabout, there was a lot of, I don't say noise, but there's a lot of, work around hepatitis, and people were getting screened all over the place. And some people were told that they have hepatitis.
Yes.
Can you talk to us about hepatitis screening? How should it be done? Who should conduct it? And are people, I don't use the word safe, but are people safe when they go to screening clinics and then they do it with the test cassette for them?
Yes. So where do I begin? Hepatitis screening is something that has been very well established now. It has already been mentioned that the disease, the hepatitis, that remains silent, that doesn't give any signs. Those are the ones that can really harm you. In the long term, it can cause cancer. It's actually one of the leading causes of liver cancer that we have. So screening is very vital. Most of the people that are diagnosed with hepatitis B, hepatitis C, that come to our clinics is through screening.
Oh, okay.
Yes. So health facilities organize screening. There are NGOs that do organize screening. And the screening is completely safe. It's done with a readily diagnostic test. We call it RDT. It comes in a cassette. So you just put a sample of the patient's blood on the cassette and it will show you whether it's positive or negative. So we have the different viral hepatitis. Some will test for, we call antibodies, some will test for the antigen. But basically, the screening is accurate and it's very safe. So we do it, sometimes you go to the secondary schools, they organize blood donations. So because it can be transmitted through blood, in the past, when there was not a lot of awareness about hepatitis. When I say past, this is about 40 years ago or more. Yes, most of them were acquired through blood transfusions. Okay, but when awareness became available, we screen everyone, every donor.
Every donor
Every
is screened.
donor is compulsory. And then when you are found out that there's some hepatitis in the virus in your blood, you are referred to see the clinician for treatment, because there's treatment.
Okay.
Yeah, so the screening is very safe. And then from time to time, like I mentioned, we have screenings in the marketplaces, at the workplaces, and it's free.
Okay.
So you go, you have yourself tested, and it's we call it Jinahoje. So as you are tested, within 15 minutes, 20 minutes,
you have your
you
results.
have the results.
Okay.
Yes.
And that result is reliable.
Reliable.
Okay.
Yes. The reason we refer people who are screened, who get a positive result to see the clinician, is that it's not everyone who develops a positive result in the screening that has an active disease. Okay. There are some people that get the disease and then the immune system fights it. And then once you get it, and you are protected for life. So the antibodies remain in your blood. But when you do the screening, it may still be positive.
Okay.
So when you come, then we decide, based on other tests that
you would do,
whether you are still infective or you have been cured.
It's good you are mentioning, because sometimes teams go out for screening, and then they do the surface antigen and it comes back positive.
Yes.
And the person says, doctor, I see more hepatitis.
Exactly.
Okay, so let's talk to people who probably have done some screening somewhere, and then the surface antigen is positive, and then into a hepatitis test, they are just doing the surface antigen.
That's for B, hepatitis.
That's for hepatitis B, and which is what people commonly do. We'll come to why. Okay, so let me. Why do people do so? Why are people so focused on hepatitis B amongst all the alphabets of hepatitis?
A, B, C, D.
A, B, C, D, E.
Yes.
But you see, I'm going to say hepatitis, no?
Oh, it's A, B, C, D, E.
There's
G, but those ones do not cause diseases.
Diseases.
So
hepatitis. At least you So, why do people focus so much on hepatitis B in general?
Okay, so a little side note.
Okay.
So, if you are wondering where we got the names A, B, C, D, E,
true.
It's one of the best decisions made in medicine, because they give us so many big names. You try to memorize,
and you're better.
But they are in order of recognition. So when they first they discovered hepatitis A, they named it A. Then when they discovered B, they named it B.
They didn't want to worry themselves and give it some just name. They just said the first one is A and the second one is B. Okay, let's move on.
So the B is in a setting in Ghana, West Africa, is the commonest cause of liver cancer.
The B.
Okay. Is the commonest cause of liver cancer.
Okay.
And liver cancer is the third leading cause of mortality worldwide. And in Ghana, liver cancer is responsible for killing a lot of individuals. So you say that life begins at 40, but it's around this age that liver cancer is diagnosed. And hepatitis B, there's treatment for it. And then liver cancer is very preventable. So this is why we readily, we pull out hepatitis B, we make it stand out, and then we actively screen for it. Because once you have it, then we can treat it. Otherwise,
so it's treatable.
It's treatable.
And it's common in our environment.
Yes.
And it causes liver cancer.
Yes.
Wow.
When you take, so according to the statistics, when you take about, let's say, 100 people, about 23 of them could have hepatitis B. Yes, so it's that common.
That's huge.
Yes. And it differs from region to region.
Even in Ghana?
Even in Ghana, yes.
It differs from region to region.
Yes. So in the northern regions, they have more cases
of hepatitis
B. Yes, as in the upper part of Ghana.
Okay.
Yes.
Okay. Wow. So if you didn't know this, that's something that you should think about.
And everyone should have had a screening done at least once in their lifetime.
Once in their lifetime.
Yes.
So when you go and do the screening, and they say for the hepatitis B, because that's what they screen for.
Yes.
And they say your hepatitis B is positive.
Yes.
Is it the same? Does it mean that you have hepatitis? And
Okay.
I want us to drum that point home for people.
All right. So at some point you have to add C too, because we do screening for both hepatitis
B and C. Okay.
Because they are known to cause cancer. The A and the E cause an acute illness. You get it, the body fights it, and you are fine.
Okay.
So we don't really focus on that.
Okay.
We focus on the ones that can kill a lot of people. That's the B and the C. Now, when someone screens, you rightly mentioned that we do the antigen test, the surface antigen. When someone screens and gets a positive test for hepatitis B, there's another test that we do. We call it hepatitis B profile. That lets us know, because there are various stages. Someone can get a hepatitis and it's in the acute phase. And in fact, about 90% of the time, the body will clear it by itself. The body will fight the hepatitis B, and the person becomes immune to it and will not get it again. That is if the person is immunocompetent. Immunocompetent means the immune system is working fine. So when the person has that surface antigen, we go ahead to do further tests to find out that is the person in the acute phase, where we allow for the chance the body to clear it. And we also do a viral load to find out the number of viruses in the person's blood. And apart from the acute stage, there's a chronic stage. The chronic stages has different descriptions. There's one that the virus is actively replicating, actively dividing, actively increasing. In that case, the person is very infectious. The person can readily infect another person. So it's contagious, I should say, if it's the right term to use. And there's another chronic phase where the body's immune system is suppressing the virus. So it's not actively, the person has a virus, but it's not actively replicating. It's dormant and it's there. So that is the chronic stage. The person can have it, it can become dormant for a long, maybe even the person's lifetime. It may not do anything to the person. The immune system suppresses it. And then there's the third individual who has it. The immune system has suppressed it, but it gets to a point where the virus starts dividing again. All right. So when you come to the clinic, so when you have this, and then there's the other one who has the cure. Okay. So when you come to the clinic, and then we do the further investigations, that the profile and the viral load, and these are available in most of our laboratories. We can do the profile for you. It's not too expensive, and I think the average Ghanaian should be able to afford it. Yes. So when we do it, then we find out, is it in the acute phase? We allow for your immune system to suppress it or to get rid of it. When you become immune, you have a cure. Or we can actually give you treatment to help accelerate this. Or is it in the chronic phase? If it's a chronic phase and then highly infective, we give you treatment to reduce the number of viruses. So as doctors, we have guidelines that we use. The current guideline is that if someone has hepatitis and then we do the viral load, and it means that there are viruses in their blood, we offer treatment for the person. There are people who have the virus who test positive, but they don't have it in their blood. Okay. And then the virus is dormant. The immune system is suppressing it. In those people, we do what we call the long-term follow-up or watchful waiting. We just follow them up to see if anything will come up. Most of the time, nothing comes up. But just for that 4 out of 100 people who would develop that cancer, we are still wary, and we still follow up and offer treatment to all these people. So there are various things that we do.
All right. Good morning to you, Akwesi. Thank you for doing the listening. You send a message, and I'm going to read it shortly. You can send yours on 0593 932 0593 932 That's the number to send the message on if you've got a question for us. Akwesi is saying that 10 years ago, he received the hepatitis injection, the vaccination. He says, do I need to take another? Because I remember that at that time they said it is quote unquote valid for 10 years. Okay, Akwesi brings up a very important point. I think in that time where everybody was worried about the rise of hepatitis, we did a lot of hepatitis vaccinations.
Yes.
Does the vaccine protect you for life, or do you have to, after 10 years, like he's asking, go for another shot?
So the vaccine has, we call it a schedule.
Okay.
Every vaccination, we have a schedule.
Yeah.
Yes. So the hepatitis B vaccination is offered to a group of people. Okay. In fact, now everyone who wants to take the vaccination has a chance of getting the vaccination.
Okay.
And it's available for free.
It's available for free
in certain settings.
Yes.
Okay.
Yes.
So if you're a health worker, you get there because you are at-risk individuals, people who are health workers, people who have a relative or a household member getting hepatitis B, who have found out they never have hepatitis, they can also get the vaccine.
Okay.
Other people in other at-risk communities,
people in immunocompromised groups and all that.
Exactly.
Okay.
So when we give the vaccination, we have 3 phases. The first dose is given, let's say day 0, that is today. When you get that dose, we recommend that you take the second dose after 1 month.
After 1 month.
After 1 month, then you take the second dose.
So you take the first one maybe today.
Yes.
And you take the second one after 1 month.
After 1 month.
Okay.
And then 6 months after today.
And then 6 months after the first dose.
After the first dose.
Okay.
You take the third dose, which is known as a booster. And that protects you for life.
For life?
Yes, for life. Since the vaccination, we've been following up people. And for 30 years, people who receive the vaccination still have the antibody titers remaining high in their blood. And when I talk about antibody titers, is when you give the vaccine, the body produces antibodies that recognizes hepatitis B. So as soon as it enters your blood, it doesn't even infect you. The body mops it up and gets rid of it.
Okay.
So when you receive the vaccination, these 3 doses, it protects you for life. You are protected for life, yes. But if you receive the first dose, it has a limited period. I do not want to go into it because we want everyone to receive the 3 doses. And you are assured that you are protected for life. Now, we offer it to babies.
Yes.
So as part of the immunization schedule, hepatitis B is available for babies. Yes. Now, you are wondering, now there's this funny instance where, we call it phobia mensa womb. There are instances where people worry that, was I actually giving a vaccine, or was I giving water, or was I giving something else? So
people are very skeptical about vaccines.
Yes. So even as a health worker, if you want to know that truly you are protected or not, there's a lab available where they check the antibody titers. Okay, and when you check, you're above a threshold.
It means that you are given.
You know that you are given and you are protected for life.
Okay.
So the vaccine gives you protection.
It gives you protection for life. So for all those who are listening who took the vaccine years ago, I remember I took my vaccine in 2008.
Yes.
Yes, that's when I took it. I think they gave it to us in medical school.
Yes. Yes.
They gave it. It's still done, right?
It's still done.
Charlie, those injections were not funny at all. I took my vaccine in med school, so it means that, like, if you took it according to the right schedule,
yes,
you're protected for life.
Yes.
So what if somebody was taking a vaccine, you've taken day 0, you've taken 1 month, and then for some reason you miss the last one?
So we call the last dose a booster.
Okay.
So the booster is available. The person can get the booster. And then after 6 months, you can check the antibody titers to know if you are protected or not.
So if you are listening and you probably just took 2 of the shots and you, because of the 6 months period, you probably moved away or you forgot about it, doc is telling you that you can go for your booster shot.
Yes.
Okay. And when you go, you say, you've taken the 2. I think they give a card.
Yes.
When you
call a yellow card.
The yellow card, yes. When you take the shots. So wherever you are taking the injection, and make sure you're taking it at an appropriate medical center.
Yes. You are not giving water.
You are not giving water. Make sure you're taking it at an appropriate medical center and they're giving the yellow card, at least for Ghana Health Service and for Ministry of Health. I know Konfanochi gives the injections.
Yes.
I know Menshia Hospital.
Yes. Anywhere they do baby
hospital, yeah. And I think even the
district hospitals.
The district hospitals, we all give hepatitis shots.
Yes.
So the ones that are given to babies, can it be given to adults?
So we have the different one for adults. So the one for the babies, it's a combination. With other vaccines.
Yes, it has other vaccines in it.
Given to babies. So the ones for adults is mainly for hepatitis.
Hepatitis. It doesn't have any other thing in it.
No.
Mamunko said the one kwalano. Yemfa woman, so that means me warm hepatitis shot. Before you take your hepatitis vaccine, do you have to check anything? Because sometimes people say, oh, you have to, some people have probably herd immunity or something.
Yes.
And they may have been exposed, but they don't know.
Yes.
Do you have to test something first before you are giving the vaccine?
Yes. So you do the profile, the Hep B profile.
You have to do the profile first.
First.
If you haven't taken it before.
Yes, and you are not in the at-risk group. You can do the profile. And then the profile, when you have we call it the surface antibody. When you have the surface antibody, it means you have immunity. Yes, and you don't need to.
You don't need to take the vaccine.
Yes. You can also go ahead and also check for the titers, the antibody titers, and it's 10 and above. You don't need to take.
So it's not just a blanket statement. If you haven't taken the vaccine before, you can actually check before you take the vaccine.
The vaccine, yes.
If I don't check, minis can't be check it. Now in Kophobia by me area, or more hepatitis awareness, mean will be that.
Yeah.
And I go and take the injection. Will something happen to me?
No, nothing will happen to you. When obit me akano, namdodo on saying quite. It's like you've eaten.
I
go to a party.
Obiko cancer namdodo on saying quite. No, say you basically me at a Kako 600. I am. Everybody see that I am. Also the Kako 600. Okay, so if you haven't checked.
Yes.
And you don't know your titers, so say you don't know your status, you can still take the hepatitis injection.
Yes.
Oh, and I'm not doing saying quite.
Yeah. I mean, if you've eaten and you go to a party, you can still eat if you have room.
You can jump around.
Yes.
It's 9 o'clock here on 107.9 Orange FM, and here this morning I'm with Dr. MALDWYN ANSAH, and we're discussing hepatitis in general. And as you can see, we switch between hepatitis A, B, and C, and all the other alphabets in hepatitis. And we're also switching between Twi and English to give you good breath for our conversations. Good morning to you, Nanaba ANSAH. You say, Dr. ANSAH, good morning. If you want to send a message, you can send it on 0593932993. This is the Orange Health Lounge, and this morning we're talking about hepatitis. Have you taken a hepatitis shot? Have you even checked for hepatitis before? If you haven't, use this month to check for hepatitis. Let me also open the phone lines now. You can call us now on 0541 022 318 0541 022 318. That's the number to call. What question do you have about hepatitis that I haven't asked that you'd want to ask our guest? It's a big conversation, and I think it's something that we should be mindful of. Someone wants to find out that he wants to know the reason behind why people who sell food, like food vendors, why should they be checked for hepatitis?
So I don't think that is a common thing we do, but I mentioned hepatitis A, hepatitis E, that they are acute, but they are mostly transmitted through food. For the hepatitis A and E, yes.
Okay.
So we call it fecal-oral transmission. So through food, through water, contaminated water. So if someone elsewhere, let's say in a US, you actually have to be tested. You need for you to get a license to make sure that you do not have any of these to transmit to other people. Yeah, but for B and C, the B and C transmission is primarily through blood. So getting needle stick injuries, previously blood transfusions, but now that is not a thing. IV drug use, people who inject themselves, and through unprotected sexual intercourse. These are and then also from mother to child in the perinatal period. So these are for the B and C. That is how the transmission is done. So B and C is not through food. So I don't find a reason why the food seller should have B or C checked before she can work. Yes.
Okay, so 0541022318. Lizzie is saying that good morning, doctors, good work, educative show. Thank you. I remember I took mine in 2024 and I took it 3 times. And I want to know when I should do it again. Says she took her first dose. She sends me the dates. So she took the first dose on the 12th of July 2024. Second dose 14th of August 2024, and the third dose she took it 25th of October. So I think she's done the 3 doses.
Yes, she's
so
done the 3
she doesn't need to go and take any other doses.
No, she can just check her titers.
Okay, so you go to a reputable, accredited hospital or lab and say you want to check your titers.
Yes.
Okay, so Lizzie, you don't need to take any shots again. If you are concerned about your hepatitis status, you go and check your titers. So 0541022318, 0541022318. That's the number to call. Funny question someone is asking. He's saying that for those of them who buy food from outside and request the liver, he wants to know whether you can get hepatitis from consuming the liver of other animals.
That's interesting.
Just a liver. That's so someone said you eat the liver. So when you drink alcohol, the alcohol get confused with liver to attack. Whether it is yours or the one that you have eaten. Let me pick this call and then we answer the questions. Hello, good morning.